So in this study, we're looking at the long-term benefit from tamoxifen therapy, and we are contrasting premenopausal patients and postmenopausal patients with ER-positive and HER2-negative disease. And the objectives behind this is that we know that ER-positive breast cancer patients have this long-term or late risk of developing distant metastatic disease. The time to metastasis can range from months up to decades from primary diagnosis. And we also know that premenopausal breast cancer patients have a poor prognosis and a higher risk of fatal disease. And given that they are diagnosed early in life and have this long life expectancy, it's important to study more about the long-term treatment benefit or long-term risk for these patients. So therefore, in this study, we're using the Stockholm Tamoxifen randomized trials, and we're looking into ER-positive, HER2-negative patients here, and they all had 20 years of complete follow-up here. So they were all randomized to receive either tamoxifen or no endocrine therapy. And in this study, when we're looking into the different clinically used tumor characteristics, we see that postmenopausal patients with a low risk, so if they have a small tumor size or low tumor grade, lymph node negative disease, or PR-positive disease, or have tumors of low genomic risk, we see that they have this long-term benefit from tamoxifen. Whereas in premenopausal patients, we see that fewer of these tumor characteristics that generally are associated with a good prognosis are associated with tamoxifen benefit. So we see it for PR-positive disease, lymph node negative disease, and if they have tumors of low genomic risk. We also do time-varying analysis in this study, so we look at how the treatment benefit varies over time, and we have 20 years of follow-up for patients. And in that, again, we see that postmenopausal patients, they have this long-term or long-lasting benefit from tamoxifen, whereas premenopausal patients have a more short-term benefit. We see in this that the benefit seems to stay for between 5 to 15 years from primary diagnosis, so the treatment benefit seems to diminish over time. So I guess the main conclusions from this study is that it is suggested that there is a clear difference between premenopausal and postmenopausal patients. We see that postmenopausal patients of a low clinical risk have this long-term or long-lasting benefit from tamoxifen, whereas the benefit seems to diminish over time for premenopausal patients.